Think you might be pregnant but aren't sure yet? You're not alone. Most people only think of morning sickness or missed periods, but your body could be whispering to you in ways you've totally missed. These aren't the big, dramatic signs you see in movies. These are the subtle shifts, the little nudges your system gives you, trying to tell you something profound is happening. So, let's dive in. Let's talk about 14 early signs of pregnancy most women overlook, and what they really mean. One of the very earliest signs, and one that's so often mistaken for something else, is implantation bleeding or spotting. You might notice just a little bit of light pink or brown discharge, maybe when you wipe, or a faint stain in your underwear. This typically happens about a week to 12 days after conception, which can be right around the time you might be expecting your period. It's not a full flow. It's usually much lighter, more like spotting, and it doesn't last as long as a typical period. Many women see this and immediately think their period is starting early, or that it's just an unusually light one. So if you notice this kind of spotting, especially if it's out of character for your usual cycle, it's worth paying attention to. Right alongside, or sometimes even preceding implantation bleeding, you might experience mild cramping. These aren't usually the intense, debilitating cramps some women get with their periods. Instead, they might feel like little twinges, a dull ache, or a slight pulling sensation in your lower abdomen. It's subtle, often so subtle that you might dismiss it as indigestion, premenstrual symptoms, or just one of those unexplainable body quirks we all get from time to time. Early pregnancy cramps are generally mild and sporadic. If you're experiencing sharp, persistent, or one-sided pain, that's something you should always get checked out by a doctor. Suddenly feeling like you've run a marathon when all you've done is walk to the kitchen? This isn't just regular tiredness, this is early pregnancy fatigue, and it can hit you like a ton of bricks. It's one of the most common, and often one of the most debilitating early symptoms caused by a massive surge in the hormone progesterone. Your body is working incredibly hard, even before you consciously know you're pregnant. Progesterone is essential for maintaining a pregnancy, but it also has a sedative-like effect. On top of that, your metabolic rate increases, your blood sugar levels might be fluctuating, and your body is diverting a huge amount of energy towards building the placenta and supporting the rapidly growing embryo. So if you find yourself inexplicably exhausted, don't just brush it off. Listen to your body. Finding yourself making more frequent trips to the bathroom even before you've missed a period? This can be another surprising early clue. One of the main culprits is the hormone HCG, which the embryo starts producing shortly after implantation. This hormone increases blood flow to your pelvic area and kidneys, making them more efficient. Your kidneys are working harder to filter the increased volume of blood circulating in your system, and that means more urine production. This symptom can start quite early, sometimes within a couple of weeks of conception. Suddenly, does the smell of your morning coffee make you want to gag? A heightened sense of smell, sometimes called hyperosmia, is a fascinating and often very early sign of pregnancy for some women. Things you barely noticed before, or even enjoyed, can suddenly become overwhelmingly strong or even offensive. The exact reason for this isn't fully understood, but it's widely believed to be linked to the surge in hormones, particularly estrogen. These hormones can affect the olfactory receptors in your nose, making you more sensitive to various odors. This newfound superpower can be quite dramatic. Ever experienced a strange, persistent metallic taste in your mouth, like you've been sucking on a handful of old coins? This unwelcome sensation is known as disusia, and for some women it's one of the earliest and most peculiar signs of pregnancy. It can appear out of nowhere, often in the first trimester, and can linger for weeks or even months. This metallic, sour, or generally off taste is thought to be caused by the hormonal changes of early pregnancy, particularly fluctuations in estrogen levels. Estrogen plays a role in our sense of taste, and when its levels are shifting dramatically, it can throw your taste buds out of whack. It can affect how all foods taste, sometimes making even your favorite dishes unappetizing. One minute you're weeping over a sentimental commercial, the next you're snapping at your partner for no good reason, and then you find yourself giggling uncontrollably at something silly. If this sounds familiar, you're not going crazy. You might just be experiencing the emotional whirlwind of early pregnancy. Mood swings are incredibly common, driven by the same hormonal tidal wave that's orchestrating all the other physical changes in your body. The rapid increase in hormones like estrogen and progesterone can have a significant impact on your neurotransmitters, the chemical messengers in your brain that regulate mood. You might feel more sensitive, more irritable, more anxious, or just generally more emotionally volatile than usual. It's okay to feel all the feels. Feeling uncomfortably full, puffy, or gassy, even when you haven't eaten a particularly large meal or anything out of the ordinary? Welcome to the world of early pregnancy bloating. That familiar hormone, progesterone, is once again a key player here. While it's crucial for maintaining pregnancy, it also has the effect of relaxing smooth muscle tissue throughout your body, including the muscles of your digestive tract. When your digestive system slows down, food moves more sluggishly through your intestines. This slower transit time can lead to increased gas production and that sensation of being bloated and full. It can feel very similar to premenstrual bloating, which is why it's often overlooked or mistaken for an impending period. For many women, one of the very first physical clues that they might be pregnant is a noticeable change in their breasts. They might feel fuller, heavier, more tender to the touch, or even experience a strange tingling or aching sensation. This isn't just your typical pre-period breast soreness. It often feels different, sometimes more intense or starting earlier than usual. These changes are driven by the rising levels of hormones, particularly estrogen and progesterone, which are gearing up your breasts for their future role in milk production. Blood flow to the breast tissue increases, causing them to swell slightly. The milk ducts begin to develop and grow. Alongside bloating and gas, another delightful gift from the hormone progesterone can be constipation. If you find your digestive system has become noticeably more sluggish and you're having trouble with regular bowel movements, this could be an early indicator of pregnancy. Just like with bloating, progesterone relaxes the smooth muscles of your intestines, which means food and waste move through your system at a slower pace. This slowdown allows for more nutrient absorption, which is beneficial for the growing baby, but it can also mean that more water is absorbed from your stool, making it harder and more difficult to pass. This can start quite early on, sometimes even before you've missed your period. You've heard of the pregnancy glow, that radiant complexion some lucky women develop, but what often gets less attention are the other, sometimes less glamorous skin changes that can occur very early in pregnancy. For some, instead of a glow, it might mean breaking out like a teenager again, with pimples popping up on your face, chest, or back. These skin changes are, you guessed it, largely due to hormonal fluctuations. The surge in hormones, particularly androgens, can stimulate your sebaceous glands to produce more oil. This excess oil can clog pores and lead to acne flare-ups. Suddenly feeling a bit dizzy or lightheaded when you stand up too quickly? This can be another subtle and sometimes unsettling early sign of pregnancy. These sensations are often related to changes in your cardiovascular system and blood pressure that begin to occur shortly after conception. Early in pregnancy, your blood vessels start to dilate to accommodate increased blood volume, and this can sometimes lead to a temporary drop in blood pressure. When your blood pressure is a bit lower, or when it drops suddenly upon changing positions, like standing up from sitting or lying down, it can reduce blood flow to your brain momentarily, causing that feeling of dizziness or faintness. Additionally, fluctuating blood sugar levels can contribute to these woozy spells. Do you suddenly feel like you have a persistent stuffy nose, or that you're constantly congested, but you don't have any other cold or allergy symptoms like a sore throat or sneezing? This could be a little-known early pregnancy symptom called pregnancy rhinitis. It's essentially nasal inflammation and congestion caused by hormonal changes and increased blood flow, and it can start surprisingly early for some women. The same hormones that are doing all sorts of other work in your body, like estrogen, can cause the mucous membranes in your nasal passages to swell and produce more mucus. The increased overall blood volume in your body during pregnancy also contributes to this swelling in the delicate tissues of your nose. The result? That frustrating feeling of being perpetually stuffed up. Are your nights suddenly filled with incredibly vivid, bizarre, or intensely emotional dreams? Or conversely, are you finding it harder to fall asleep or stay asleep, tossing and turning despite feeling exhausted during the day? Significant changes in your sleep patterns, including both vivid dreaming and insomnia, can be an unexpected early sign of pregnancy, often kicking in due to those ever-present hormonal shifts. The surge in progesterone, while it can cause daytime fatigue, can also paradoxically disrupt nighttime sleep for some. Furthermore, other early symptoms like frequent urination, breast tenderness, or even mild cramping can certainly interfere with getting a restful night. Many women report experiencing unusually vivid, memorable, and often emotionally charged dreams during early pregnancy. These dreams can range from wonderful and whimsical to anxious or just plain strange. Pregnancy symptoms can be subtle, confusing, and easy to miss, especially early on. But your body is always talking. If any of these 14 signs we've talked about today sound familiar, if they resonate with what you've been experiencing, it might be time to take a pregnancy test. And more importantly, listen to your instincts. You know your body best. Trust that inner voice, that gut feeling.